Okay, good evening. Welcome to another edition of Health Talk by the Nevis Renal Society. And this evening, your host is yours truly, Dr. Grenville Liburd, filling in again for Dr. Tivon Brown, who is on sabbatical. So he says, Dr. Brown, good evening, and to all your listening audience out there, a pleasant good evening again, and we are here another edition of Health Talk as we try to bring you information that will help you with your health. And we are focusing on diabetes and hypertension, the two major factors, diseases that damages our kidneys, because the Nevis Renal Society is all about preserving kidney health and supporting those who, for whatever reason, might fall to the cracks and have to be on long-term care. We know that dialysis can be very involved exercise, and so we want to preach and practice prevention. But to practice prevention, you have to know what to look out for. You have to know the early warning signs and how to intervene early. And the sad thing is that diabetes and hypertension, they are called silent killers. There are no early warning signs that you can rely on to prevent. By the time you have signs and symptoms, it is too late. And so my advice to anyone and everyone is that you have to be proactive and preemptive to prevent these conditions from getting out of hand. And it can be easily managed by paying attention to certain technical details which anyone can accomplish and master. And so it's not rocket science, it's common sense to understand. And if you can operate a microwave, a video recorder, a cell phone, a computer, then you could manage your diabetes and your hypertension. And so, in the last two programs, we were focusing on monitoring a parameter called hemoglobin A1C. That's a shorthand code for glycosylated hemoglobin. And so we want to continue on that theme of monitoring, but we will focus tonight on a simple tool that everyone should have in their medicine chest, by their dinner table, in their kitchen, in their home, in your wallet, in your purse, and a simple test, a simple machine that can help you to monitor your diabetes, your blood sugar. And you don't need to have diabetes to have one. It's called a glucometer. Glucometer. A glucose monitoring machine, a meter. Glucometer. Mark that word, glucometer. It's a very simple machine to operate. And if you can operate a cell phone, if you could do WhatsApp, if you could post a videos camera online, then you could operate a glucometer. It's that simple. You just take some time to read the manual, follow the prompts, and you will master it in short order. And so, I will encourage everyone to be in possession, whether you are diabetic or not. Because believe it or not, some people are walking around not knowing that they have high blood sugar, not knowing that the sugars are running high, and they're eating and drinking like merry until suddenly they feel a bit wishy-washy, as they will say. They get a cut which doesn't heal in quick time. They get a flu which lingers on longer than normal. They get a strange rash in the armpit, in the groin, or somewhere in the body, fungus infection on the skin. And they come to the doctor and we do a simple test, a random blood sugar. It is over 200, over 300, sometimes in the thousands. And we do further testing, and lo and behold, they have diabetes been going on for several months, even years sometimes. The hemoglobin A1C can be up to double digits, 16%, 15% I've seen in cases. And in those cases, the blood sugar being running over 200 for greater than 3 to 6 months. For the A1C to reach up to 15%, you must have had blood sugar running over 200 for at least 6 months or more. And so that's the value of the hemoglobin A1C. You can't fake it. It gives you a fairly good reflection of the chronicity of your high blood sugar. And that's what defines diabetes, a high blood sugar. And in the good old days, before we had a glucometer, people used to test their urine, and that's how diabetes was first recognized, by sweet urine. It's called mellitus, diabetes mellitus. Mellitus is a Greek term for honey, a sweetness. So sweet urine. There's another kind of diabetes called insipidus, where the urine is not sweet, no sugar in it, and that's come from brain condition. But we are focusing tonight on diabetes mellitus, where the urine is loaded with sugar. That's how it was first diagnosed, where there was lots of sugar in the urine, and the old time physician used to observe that ants would follow the urine of patients who are diabetic. And on further examination, they realized it was loaded with sugar. And that's how the diabetes mellitus came to be defined, by high sugar in the urine, but we have gone beyond urine, and now it is high sugar in the blood. And some people can have, I said, a very high threshold in the kidney for spilling sugar into the urine. So I've seen persons with blood sugar in blood sugar over 1,000 and not a drop of sugar in the urine. So they have a very high threshold for spilling sugar into the urine. And so the urine testing has become erratic or unreliable at best, and the standard of care now is to test your blood for high blood sugar, and there are guidelines to monitor, and we have to know these guidelines. And if you can drive on the roads of Nevis, then you could monitor your blood sugar with a glucometer. You could understand to keep in your lane, because if you go out of lane, you will collide with oncoming vehicles, or you will run off the road on the edge. So you got to stay in lane, and that's what monitoring is all about: keeping your eyes on the road and staying in your lane, so you could travel safely with your health care through life, by keeping your blood sugar within a certain range. And I advise my patients a simple mnemonic: 60 to 160. Once the blood sugar goes below 60, you can't function. Your brain will shut down. Your muscle will feel weak, because we need sugar for energy. And below 60, the body muscle system can't function. The muscles just get fatigued, weak, lacking energy. You take something sweet and you revive. You get a boost of energy. So we need sugar. It's essential for our living. But too much of a good thing, they say, can be problematic. So even though we need it, the body keeps it regulated within that fine range between 60 and 160. The fasting should not be below 60. If you get below 60, you have problems of hypoglycemia. And the post meal at 2 hours, it should be less than 160. So I use those parameters: 60 to 160, easy to remember. And if you just keep those numbers in mind, the fasting should be anywhere between 60 and 100. Once the fasting gets up to 110, 115, 120, you're in trouble. And if at 2 hours after a meal your blood sugar is more than 160, you are in trouble. So those two numbers are easy to remember. That's your lane, 60 to 160. And you have a glucometer, then you could pull it out quickly and do a finger prick. Capillary sampling is very reliable and accurate, almost equal to a venous sampling, and it has become standard of care now to use a quick glucometer test, capillary testing, to make a quick estimation of whether a person is having high or low blood sugar. And so I encourage everyone hearing my voice this evening to get a glucometer, whether you're diabetic or not. Have one in the family home. Anybody with a crisis you can always check their blood sugar and report to the doctors, and they could give you advice over the phone. And it's an empowering tool. It puts you in charge of your health care, that you could test as often as you want, because it is now your tool to use as you see fit. And all we ask of you is that you keep a record of the time of testing, the time of your last meal, medication, or any contextual activities, exercise, whether you have a fever or cough, you're excited, or anything that is relevant in the context. You can make a note in your record. So note the time of the test, the time of your last meal, time of your last medication, and those timings are important to correlate and interpret the test properly. And so those are the general overview guidelines, that a post-meal 2 hours is a standard reference time. It's called 2 hours postprandial, and it's a standard reference time, and it should be 160 or lower. And why is that? Because we eat to get energy, and the energy comes in the form of carbohydrates primarily. And carbohydrates are, as I said before, they are chains of sugar molecules linked together. You have different sugars, but the one that is most common is glucose. And so just think of a bead, a necklace with lots of beads on it, and each individual bead is a sugar molecule. So the whole necklace is a starch, a carbohydrate, which have a string of sugar molecules linked together. And during digestion, the links are broken down, and each individual bead is released and absorbed into the bloodstream, and it circulates around the body, and it goes to the different cells which need it. Certain tissues, brain and muscle, they could draw sugar directly from the blood without the need of insulin. But all other tissues, insulin is like a key, a gatekeeper that opens the gates in the cell membranes to let the sugar into the cells. But brain and muscles, they could use sugar directly without need for insulin. And that's the danger, why you could be going about life happy-go-lucky and no care or concern, because once the brain and muscle get the energy, you can keep going until something else happens to bring you to inspect, to look into what's going on in your body. And that's the danger, that a lot of people feel, oh, well, I'm feeling fine, I'm feeling energetic. Yes, but the other cells are struggling because they're not getting enough to keep them, but they have enough reserves inside. And so they could go for a great while without insulin until the system crashes. And that's when people begin to realize something is not right, because they feel wishy-washy. They can't pinpoint exactly what's wrong, because the cells have been starving, they've been struggling to cope. And then, well, you do a test and you realize that the metabolism, the biochemistry is out of control. And so get into the habit of monitoring your blood sugar, and do it as often as you can. If you have your own glucometer, you have license to test as often as you can. All we ask you to do is to record the information. And there are standard spreadsheet charts that have been developed to record it: fasting, before breakfast, after breakfast, before lunch, after lunch, before dinner, after dinner. And you follow the guidelines, record the blood sugar, note the time of testing, the time of the last meal, time of medication, any other contextual information. And then when you come to your healthcare provider, you work with that record and you share it with them, and then they could help you to interpret and explain what's going on with your diabetes control. And the other details of medication, exercise, dieting, then you can have a good discussion, because you have relevant information about it. And if you want to be very fancy, you could record your meals too. Weigh every ounce of food that you eat, you know. And if you know the kind of food in terms of protein, carbohydrate, fat, then you could break it down accordingly. Or just say 5 slices of bread, or 5 ounces of bread, 4 scoops of rice, or 6 ounces of rice, whatever the case may be. You could monitor your food as well, and then you could begin to gauge the impact of your food on your blood sugar. If you know you have 4 slices of bread for breakfast, and you test your sugar 2 hours afterwards, before breakfast and after breakfast. Then you have a before and after record to note the impact of that meal on your blood sugar. And it can be very eye-opening to those of us who do that analysis. And then you begin to understand the impact of your food on your blood sugar. And then guess what? You begin to know how to chop and change, cut back certain things and observe the effect, And it's enlightening, it's empowering to understand how food can affect your blood sugar and other parameters. So I want to encourage everyone hearing my voice this evening to learn to monitor your blood sugar. You can monitor other things too, blood pressure, etc., temperature, your weight and other things, but your blood sugar is very, very important for diabetes control. I tell people you don't walk through the street of Charlestown or any city with your eyes closed, because you will get into trouble, get into accident. And if you go through life not knowing how your body is handling the meal you consume in terms of your blood sugar, etc., then you're essentially living life with your eyes closed, because you don't know how the sugar is rising and falling, especially if you are diabetic. And most people, the body could regulate itself, but in diabetics, that regulation has been impaired by the lack of insulin. And that's why you need to enforce regulation by monitoring and then intervening by changing your diet, exercising, medication accordingly. And so those are simple things to observe. Everyone knows how to drive a vehicle, operate a machinery, and you stay within the lane, you stay within the guidelines, you follow the manual instructions. And so our body have similar instructions for us to observe, similar rules and regulations to follow for good diet, good hygiene, good health care, and monitoring is part of that framework. Just don't eat as you like, do as you like, but learn to monitor what you eat, how much you eat, when you eat, and then monitor the effect of what you eat on your body. And doing these simple tests for diabetes, especially, you test your blood sugar. There are other things we can monitor in your bloodstream as well, which we have spoken briefly to in past times. But tonight we are focusing on the key parameter that defines diabetes, which is your blood sugar. And a simple tool called a glucometer, they're readily available. You can call my office and we can give you information how you can get one. And they don't cost much. Some are being given away for free, depending on sources. So just give us a call and we can get you set up with your own glucometer so you could be in charge of your healthcare, your diabetes management. And then we can walk you through the steps of how to monitor and how to interpret what you record when you monitor your blood sugar from time to time. And so, very simple. And keep life simple, folks. Keep it simple by doing things step by step. If you want to know how the food affects you, then you change one item in your diet at a time. Monitor your food. Change one item at a time and observe the effect. You could have a one item diet. If you want to be very technical, have some mangoes, 1 mango, 2 mangoes. You could measure them before you eat, and then you test the blood sugar before and after, and you see the impact of mango on your blood sugar. You could be amazed. You could go from 60 to 600 in no time if you are diabetic, because mango are very sugary fruit when it's ripened. Same goes for banana, oranges, grapes, And so, but if you want to experiment, you have a tool in your hand that you could experiment. And nothing wrong with experimenting. Experience and experiment have the same general concept. And that's how we learn in life, by experiencing things old and new. And then we say, oh no, that's not good for me because it gives you a bad reaction. And you learn from your experiences. And so in science, we learn by experimenting, doing things under controlled conditions. So there's nothing wrong with experimenting. And there are safe ways of experimenting, which I have just given you the guidelines, but you have to record, measure. What you can measure, you can manipulate and control, right? If you can't measure it, then you have lost control. So learn to measure. And there are tools to measure different things. And for diabetes, we have a simple tool called a glucometer, which everyone should have one or two in their house, right? And keep it in good working order, and it will save many lives from amputation, cataracts, blindness, retinopathy, kidney problem, because you know how learn to eat responsibly, because you're monitoring your response to your meal, especially screening for diabetes. And it's empowering. I mean, it's pain my heart to see people suffering with amputations and the kidney failures and so on. And it tells me that we are failing in our work as doctors to empower and educate our patients. That's why I like to come on these programs to share the knowledge, but the knowledge has to be acted upon. And if you're hearing my voice tonight, then if you don't understand, then find me somewhere. I'm not hard to find in Nevis, you know, and we can have a conversation. I love to teach, I love to explain things, so it takes nothing off me to explain to you how to be in control. Then we can all go and play golf together, we can go on a cruise together and enjoy life, right? But when I see you on a bed suffering, it pains my heart. So let's break the cycle so we could all enjoy life together. And we could go on a hike, go on a cruise. And about a month ago, they had a lovely annual walkathon for the Union Society. We walked from the Malcolm Gishard Park up to Cohoon Junction, went up to Barnesgot, and we came down to Jessops and back to Malcolm Gishard Park along the Island Main Road. And it was a lovely walk. I enjoyed it, you know, and it was a very good atmosphere, and thankful to the division committee for supporting the Union Society over these years in the turnout to these events that we host to raise awareness. And so we want to encourage you to keep supporting the society that has sponsored this program in conjunction with Vaughan Radio, and give us this platform where we could come here once a month and explain these technical details about taking care of your health, you know, because it's important for us. And yes, and we enjoy the fellowship, the company, and the walk. Last week, we also had an appreciation for those persons who are having dialysis, who are kidney patients. You know, they have to go to St. Kitts 2-3 times a week sometimes. And, well, we are there to support them. And we pray for the day when they could have dialysis right here in your home in Nevis, you know. We know we had it here in Nevis many, many years ago. A private individual had it in their home, and that was the big move for the society to be started over 25 years ago, because of that experience of this good gentleman who, through good fortune of insurance, etc., was able to have a dialysis machine in his home for 7 years or thereabouts. And that eye-opener experience gave us the mojo, the motivation to keep going for these 25 years since the society was started, because we know that dialysis can be done right here in Nevis. Yes, it takes some technical underpinnings to make it happen in the public space, and those can be easily managed. And so we want to encourage everyone to do what has to be done to monitor, to take care, and to put things in place for those who will fall through the cracks. And, well, we are here to educate and encourage you to look after your health. I think I've been talking non-stop for the last 20 minutes. So if there's anyone out there who want to call in, you have the line open, 469-1616, 469-1700. You could ask me any question you want for the next couple of minutes before we say goodbye and good night until next month. A little break for station identification. This is Health Talk by the Nevis Film Society on Vaughan Radio. 860 and the AM band. So folks, the take-home message before we leave tonight is stay in your lane, right? 60 to 160. You shouldn't go below 60. You shouldn't go above 160 at 2 hours after meal. And if you stay in your lane, then you will keep the hemoglobin A1C under 7%. And you will prevent damage to your end organs, especially kidney, retina, blood vessels, heart, nerve tissues, right? 60 to 160, that's your lane. And the fasting should be between 60 and 100, and the 2 hours after meal should be 160 or below. So that's your lane, 60 to 160. And get your glucometer. Give me a call if you don't know how to get one, and we can guide you in that direction. And so folks, it's been a pleasure again bringing you this information. And since there's no one who wants to talk to me tonight, I think I will tell Von Radio thank you for the platform. I know there's another team waiting to come in to share information about the state of the country, but I'm talking about the state of your health tonight. And a healthy population leads to a healthy nation and a productive nation. So you have knock-on effects for those who come in after me. That keep your organs healthy, keep your health in good order, and the country will produce and produce and produce. So over and out. Until next time.
You were just listening to Health Talk, sponsored by the Nevis Renal Society in collaboration with Von Radio.